Hi, I'm Lisa Schnedler, President of Upland Hills Health, and I want to welcome you today to the first look of our new patient care areas. We are so excited to show this to you. I'm going to turn you over to Tina White and Ryan Teasdale, our Facilities Director, who are going to lead you on the tour.
So Ryan, before we get started on the tour, can you just give me an overview of this building project and what are the patient care areas that we're able to start using now?
Well, for those of you that'll remember, we had a clinic building that was in the center of our campus. We've taken that clinic building down. That was built in 1993. We were able to remove it and open up about 8,000 square foot of space, and from there build back in a much larger amount. The areas that we will be opening up will be a new patient floor or a med-surg unit, also an ICU, and also the labor and delivery unit is also brand new. In addition to that, on the lower level, we have new surgical suites.
Wow. So it seems like Upland Hills Health just finished a major building project.
Well, it seems like it was yesterday, but in reality, we haven't had a construction project since 2009. Wow. It was started in 2007, completed in 2009, so it's been a 10-year window since we've really undertaken a construction project.
And were any of the areas that were remodeled then part of this building project? Did any of that have to be redone?
Actually, no. Everything that has been done in this project is new. We are going to be remodeling a couple of portions of the building that haven't really been touched since about 1993. So nothing was built in 07 to 09.
And what will this mean for our patients and our visitors?
Really, the whole idea was convenience. We don't want our patients and visitors walking long distances. So the idea was to bring everything back to the middle. By building the new building in the center of campus, as you can see, the entry point, the registration desk, and then we also have the new waiting space for the ORs. Right around the corner from this is the new main elevator bank to the patient floor. So everything has been brought back to the middle for convenience and ease of finding your way around.
Oh wow, okay, so this is the new patient floor, right?
That's correct, okay, here we are.
Great. So tell me about it. Have we added rooms or?
Well, actually, Upland Hills Health is a critical access hospital, and by definition that means we have 25 beds, 25 patient beds. So the real difference is in the new facility, they're all private rooms. So patients will have their own rooms. In the old hospital, it was doubled. So they were semi-private, they could be doubled up. Here everybody gets their own space.
Nice. Can we take a look at one?
Absolutely.
Okay.
Here we are.
Okay.
First thing I want to mention, a lot of thought went into these. This is called a nurse server that can be filled from the outside of the room. So people don't have to enter the room to stock the supplies for the room.
Nice.
When you enter the room, nursing doesn't have to leave the room to get access to the supplies. So they open from both ways. The idea is to provide a little more privacy for the patients.
Yeah, nice.
So from there, the bathroom. A lot of thought and energy went into designing the bathrooms. The biggest driver was to eliminate falls. So the rooms are smaller. However, there's grab bars within reach of anywhere you need to be in the bathroom. The doors are designed to swing both ways, so we can get into the bathroom to use the bathroom, or we can swing it the other way to make more room for showering and nursing equipment, that kind of thing. When we step across, this is the workstation for nursing. The bed will be right in front of me. And this is the head wall. Again, another piece that a lot of thought has gone into. One of the biggest things we strived for was providing a more of a hotel feel versus an institutional feel. Mm-hmm. So we've been able to hide our med gases and the canisters, so if nursing needs to use them, they can. And if they don't, of course, then we can just push them back down. Okay. And provide more of a hotel feel versus an institutional feel.
And what's that, Ryan, above your head?
This is our new patient lifts. So 4 of the rooms have been equipped with a lift that allows nursing to pick up a patient with the use of this lift to position them in a standing lift or a wheelchair without having to manually pick somebody up to help limit workplace injuries. So with the bed here, the whole idea is to allow them a view of the countryside or a rooftop garden.
Very nice.
And this is one of our labor and delivery rooms. And just like a patient room, a lot of thought and energy went into the conveniences and the efficiencies of this room, really designed around staff and the new moms and families, making them as comfortable as possible. We've added some amenities to these rooms as well, with the bathrooms, each having a choice of a full shower or a whirlpool tub. Again, we've hidden any of the head wall mechanicals, and then lots of window space, so we really get the views of the outside.
A lot of nice lighting.
Yes, absolutely.
So Ryan, you were telling me that a lot of efficiencies have been built into the floor plan. What did you mean by that?
Well, a lot of thought process went into not only the location of the building, but how it was laid out to gain those efficiencies. Anywhere from security of the floor, accessibility, to how the labor and delivery unit is protected from a security standpoint, to accessibility from the staff getting to the floor. These elevators are the service elevators that'll supply the floor. No longer will they be coming up the front lobby in the hospital. So all that stuff is going to be brought to the middle, brought right up to the patient floor. So we gain those efficiencies that way. And one other efficiency to mention is the pneumatic tube. That really allows us to push samples and medication to the lab and back and forth to really limit the travel that staff has to do. We can now do it with a pneumatic tube system.
Okay. Pneumatic tube like what they use in the banks?
That's exactly what it is.
So it sends information.
It's a metal tube that runs on air pressure just like the banks.
Okay.
And another thing that we've really done is tried to bring the outside light into the building to help with visibility in the building and energy bills.
A lot of beautiful natural light.
Yes. And this is one of our 2 new OR suites.
Nice. So why did we need to build a new surgical suite?
It's really about preparing ourselves for the future. Technology is changing all the time, especially in healthcare. Our surgical team did a fantastic job of selecting or putting together this room in a manner that is very functional today, but also allows us the adaptability to change as technology changes and allow us to grow with the future.
Nice. It looks like it's still being set up, so we're seeing this for the first time.
That it is. It's still got a long ways to go, but we're just about there.
Very nice. And then it looks like there's more construction happening off in the side areas. What's happening there?
Well, one of the biggest drivers for building the new ORs was the pre and post-op spaces. To service the ORs and to keep them functional, you need that space on the front and back end to treat patients properly. So we're next phase. We still have to go back and build in 15 prep and recovery rooms to really finish off the OR spaces.
Okay, so that has yet to come. 15 additional and so that's before and after your surgery.
That's correct. And
15 rooms in that area.
And that is yet to come.
Okay.
And after the tour, as you can see, we're right back at the main entry.
Right. So how was the tour? It was really impressive, Lisa. And if you don't mind, I've got a few questions for you.
Sure, that'd be great.
Ryan, thank you so much. I appreciate the tour.
My pleasure.
Yeah,
Thank you, Ryan.
Enjoy.
Lisa, I just love the tour. It was so beautiful and so
great.
exciting to see these new spaces.
Yes.
So I'm curious though, how much would a project like this cost and how does the hospital plan to pay for that?
Sure. So we had budgeted $32 million, and it's coming right around $32 million, so right on budget. And in terms of how we're going to pay for this, we're using some of our cash reserves. We are financing some through USDA, some through banks, and then also we are really truly relying on the generosity of our good friends of the foundation. And speaking of the foundation, would you like to meet Julia Ulrich, the head of our foundation?
I'd love to.
Absolutely. Julia?
Hi, Julia.
Hi, nice to meet you.
Nice to meet you.
So Tina, I'll see you at the end.
Okay, sounds good. Thanks. So you're the foundation director.
I am.
How does the foundation get involved in a building project like this?
Yeah, well, it's a very exciting process, actually, and I'm glad that you got to see the building today because it's a beautiful, beautiful building, and we're just so excited to get patients in there and start treating patients. So with this project, like Ryan and Lisa were telling you, there's an entire second part of this project. So once we are done with this piece, we'll be moving into the next piece of the project, and that's where the foundation will get involved.
Okay.
So that includes the C-section suite, the pre-op and post-op rooms, and then a lot of those final details that Ryan was showing you and telling you about. So we're excited because soon we'll be reaching out to the community and inviting their support to help us complete this project.
So how would a community member do that? So if a person wanted to contribute and be part of this building project to help support the hospital, how would we do that?
Sure, you can call me here at the hospital. So you can call the main number, 930-8000, and ask for Julia. Or you can visit the website, which is uplandhillshealth.org, and there's lots of information on the website about the building project specifically. And then you can visit the foundation page, which has more information about the capital campaign and an area where you can make your gift.
Thank you again for coming along on this tour. We were so excited to show all of this to you. We really see this new area as a stage for our employees to deliver the excellent care we're known for, and we could not do this without you. So thank you so much for your ongoing support.